what about the role of stress that stress plays or racial bias? And I've always wondered what racism and stress and all those things, how those things have damaged our health, our health as well as our physical health over the years. I mean, stress definitely plays a huge part in that, and a lot of times, and especially during this time now, we are we are the guests here. We have another guest. We have Aisha Beamla.
That's right.
Did I say that right?
That's right.
Okay. She is a postdoctoral fellow at the Center for Asian Health at Temple University Lewis Katz School of Medicine. So I gotta ask, you guys are here today. What's the Lewis Katz School of Medicine's role down here today, and what's your interest in terms of health disparities in the Black community and in other communities?
Yeah, well, thanks for having us here. We are part of the Temple Lewis Katz School of Medicine, so the Center for Asian Health has been housed in the School of Medicine, and we focus on various community-based and interventions to reduce cancer and chronic disease health disparities in the Philadelphia area. So today we're here to just raise awareness about some of the topics that we cover in terms of cancer screening and addressing sexually transmitted infections and teen pregnancy in the community. And we're happy to be here with Dr. Stan, with the Center for Health Equity to at this health fair. I think it's really important to give resources out and be able to help the community and hopefully allow people to get more resources.
Right.
For health education, also improving their health.
Having Temple University in the heart of this community, these communities are the epicenters of disparities in Black healthcare and all that. So, how important is it to kind of be this close and have this kind of proximity to the community?
Yeah, I think it's extremely important. Actually, we just are part of the Proud Teens of Philly. Our teen sexual health program was. We were doing the program with Dobbins High School. We just finished 2 months ago, so I think it's extremely important, and obviously, it's important to really get community input. And in all the studies and projects that we work on, we really are doing community-based participatory research, which is basically, involving community members and leaders from even churches and senior centers, in the community schools, to really understand what the issues are and how, I think it's important to get community input and having them be part of the research projects as well. So,
when it comes to specific healthcare issues that are in communities like that, from what I'm reading, just from looking at everything, seems like diabetes and all those things are like the diseases that people really don't catch at an early level. So how important is it, to have these types of centers, these days like this particular, health fair? How important is it just in terms of raising awareness that people understand what's going on?
Yeah, I think it's extremely important, and in addition, prevention or getting screenings and preventing it at an early stage is really important. And I think, especially with racism and these structural issues that exist, really have a role in people not getting screened earlier on time, and I think it creates a lot of barriers. So it's also important not only to do health fairs and raise awareness in that way, but also address these structural issues as well.